Is insight for the nearly 30 million people who suffer from migraine headaches in this country.
It's not a new drug, but a couple of high-tech electrical gadgets. And CBS 2's Dr. Max Gomez is here now to tell us all about it.
That's right, Christine Maurice. You know, there are decent treatments for migraines, but they all have drawbacks. The drugs have side effects, or they're hard to take. Biofeedback and cool compresses help for mild attacks, and there's even surgical approaches as a last resort. Now, there's a couple of electrical gadgets that offer safe relief.
Can find yourself in bed, vomiting, dark room, and you need complete silence and darkness. It can go 24, 48 hours.
That's what the past 22 years have been like for Flori Gerasalmi, suffering chronic, debilitating migraines. She's tried most of the medications out there, from injections to tablets to nasal sprays, but they're tough to use in the middle of an attack.
When you have a migraine and you're very nauseous and you're shaking all over.
Not to mention the nausea that afflicts more than half of all migraine sufferers, meaning
some of them don't take the medication at all.
Or they're vomiting.
Or they're vomiting it up.
That's where this newly approved patch comes in. Called Security, it contains a tried and true migraine drug, sumatriptan, but with a twist. Because the drug molecule is too big to be absorbed through the skin, the patch contains a couple of small watch-type batteries that push the drug painlessly through the skin. So even with severe nausea, you absorb the drug.
Twice as many people, compared to the placebo patch, had total absence of headache within 2 hours when they used the patch.
Then there's this completely different approach. It's called Cefaly. Flori agreed to demonstrate it even though she didn't have a migraine. First, a small electrode patch is applied to the forehead, followed by the battery-powered headband. The headband delivers mild electrical pulses to the sensory nerves above the eyes. It's thought that these nerve impulses travel back towards the brain and somehow interfere with the migraine pain signals.
It's actually almost a warm tingling.
Now, the Cefaly nerve stimulator has been approved in Europe and Canada and is awaiting FDA approval in this country. It's about $350 plus the ongoing cost of more electrode patches. Neither devices are cures, although Cefaly is said to help prevent migraines, but they do offer new help with fewer side effects. Christine?
All right, some great options. Thank you, Dr. Max.